Hip injuries are becoming much more common in athletes. We're here with Dr. Olusanjo Adeoye to talk a little bit more about that. And why is it that we're seeing more hip injuries?
Well, we think it's related to increased level of activity in general, especially in our teenage population, year-round sports, as well as the rise in single sport athletes. So I think they're just having more opportunities to injure their hip.
Yeah, so there's a cause of maybe overuse and opportunity?
Yeah, the most common cause that we see is actually individuals that have developed an abnormal shape of their hip, and which is called femoral acetabular impingement or hip impingement for short. And in those individuals, they have what we call a hip at risk, which means they, with the usual level of sporting activity on top of the increased level of sporting activity, they have more opportunities to injure the cartilage in the hip joint.
What are some symptoms of hip impingement?
The most common symptom is anterior groin pain, and we've had a lot of athletes who've come in with quote-unquote groin pulls, hip flexor strains. There are different words that is being used to describe it, but that's usually the most common symptom. Some people will also feel a tightness and just not being able to get the same range of motion that they're accustomed to in the hip joint.
How is hip impingement treated?
We usually start conservatively with rest, anti-inflammatory medications, activity modifications, as well as sometimes corticosteroid injections.